Hi, my name's Alexis Quinn. I'm autistic. I was detained in hospital for 3.5 years. I was subject to a lot of restrictive practice, including routine restraint, seclusion, also long-term segregation. And I ended up actually having to flee the country whilst I was on the section. And I've written a book about it called Unbroken. And I'm now pleased to work for the Restraint Reduction Network. And to support CQC in their efforts to improve the culture and quality of provision for people receiving care. Now, I've been involved with the RSS review on the EAG for that group, and on the back of that work, spoken at a number of events, including some conferences and parliamentary events for that. And more recently, I've been on the EAG for the closed culture work. As part of my work for the RRN, we carried out some consultancy work on behalf of the CQC, and we heard in the form of surveys and also forums from close to 400 people about their experiences of closed cultures. Now, some of that information was like really hard hitting, even though I've experienced the harsh end of the system. We need to see more people being cared for in the communities, obviously. We need to expect, as a matter of course, timely responses to trauma and crisis. Often these start out as social problems and they become medical problems because the community isn't kind of proactive. Yeah, at the moment we're in a situation, aren't we, where things are reactive. We leave things to the very sort of last minute, and this is what invites detention, and this is what invites restrictive practices. Also, I think communication, this is something we can do fairly easily, needs to flow between services, and the trained workforce then needs to be able to help, and not hurt. And then moving on to safety through learning, a lot of this is about driving culture change. The CQC can influence this by ensuring, stronger safety in cultures. And if the CQC expect the service's primary response to be learning and improvement to safety concerns, then this is going to have to make services, isn't it, step up if they want to get a good rating. And when safety doesn't improve, the CQC have got to have the teeth to do something. They've got to be willing to use them, and only in doing that can they take action to protect us. So look, I hope the CQC drives these areas. I hope people who find themselves in situations like I did, where they need care, that they get that care, that they deserve, and I hope that services see us as people.
My name's Isaac Samuels, and I live in the east of London with my partner and 4 dogs. I have had many years of experience of kind of mental health services and systems. I've spent many years in and out of hospital. So I was aware of the work that the CQC was doing, but not really fully understanding what their role was. So when I became involved in the project around closed culture, one of the things that was really important to me as someone that has experienced closed culture and really poor care was that how do lived experience stories, so the stories of people like me, really support the CQC to really inspect services in a way that makes sense, not only to the CQC, but to people that are in receipt of those services, and ultimately prevent closed culture and poor practice happening in the first instance. I think the work that I've done alongside the CQC has been really refreshing, because I think being in a space where inspectors talk about their own difficulties around inspections and closed culture, and it felt like it wasn't a them and us thing. It felt like we were working in a way that we wanted ultimately mental health services to be the best possible services, and there was a role for the voice of lived experience working alongside inspectors to make that happen. And I think for me, what good would look like in the future would be the CQC using lived experience more extensively to support inspections, to help drive up quality, to prevent poor practice, but really that partnership working between those with lived experience and learned experience coming together, because I think together they're really strong at recognising some of the challenges that health and social care systems and services have. I think what was really nice in the work that we did was hearing from the inspectors about, you know, what an inspection looks like, how they do the inspections, what they're looking for. But the lens of the inspector will be around some of the domains they were talking about. But that lived experience voice is so important within that. So I think it's a great opportunity going forward to get it right from the start.